Hello everyone and welcome back to my channel Law and Doctor, where I give you all the information on medical law that you will ever need as a patient. In the previous video, I had promised you that for all information that I am unable to provide, I'll bring in the best doctors, best lawyers and experts in the field to talk to you. And who better than a mix of all these, that is Dr. Nikhil Datar, to start off our interview sessions. Do take a look in the description below if you want to know about his body of work. Also, if you haven't watched part 1 of this video, check it out as well. Apologies in advance for the low resolution. It was a Zoom recording shot during first COVID wave. Desperate times, right? Hello friends, it's a pleasure to introduce my friend and also my guru in this field, Professor Nikhil Datar. Welcome Nikhil.
Hello everybody.
His face, ladies and gentlemen, may be familiar to some of you who watched the famous TV show Satyamev Jayate by Amir Khan. He was introduced and interviewed in that show for his exemplary work on gender-sensitive protocol on examination and evidence collection of survivor of sexual assault. For his patients, he is a very learned and sensitive gynecologist. For me and many of his doctor friends, he is an encyclopedia on the subject of law, and for the society at large, he is an activist for health-related rights. Being a judicial activist, he has been offered honorary posts in several NGOs, but the one that he is very passionate about is the one of which he is the founder president, and it's called the Patient Safety Alliance. Of course, we will talk about this particular act also sometime in the future video, but today at this moment, let me talk less and make him talk more. So, shall we get started, Nikhil?
Sure, absolutely.
Nikhil, in the present video, I briefly dealt with what is medical negligence, and I tried to explain the requisites to consider a doctor negligent while performing his duty as a doctor. But many times it is seen that in the court of law, that a defense that is taken by doctors is what they call as error of judgment. Now, please let us know what is the meaning of this error of judgment.
To begin with, I must say, and everybody will agree, to err is human. The fact that we are human beings, we are expected to make errors. Human ideology and human psychology says that if something happens in my hands, then it is always an error. And when something else happens in somebody else's hands, it is probably criminal negligence. Now, the degree of the error can be different. Somebody may say it's just an error. Somebody may say that it is negligence. And somebody may say that the level of negligence has been so callous that it was almost of the criminal nature. And then that typical medical, legal or legal word of criminal negligence comes into picture. If the damage caused is very large, then you will generally give a lot of importance to that error and probably not call it as an error, but maybe call it as negligence. But if the damage caused is relatively smaller, then you will probably tend to call it as an error. So for example, while driving the car, if I touch my car to somebody else, okay, I was actually busy looking at a message on my mobile. Okay, I was not concentrating on my driving. Okay, and I dashed onto somebody else's car. But actually what happened was, fortunately, that my car was so slow that I never kind of really caused a major dent into the car. Do you think that the element of negligence has become different at all in any way? The actual answer is no. There is no difference. I mean, I ought not to have seen my mobile, but I was seeing my mobile. That's the fact. So outcome should not decide whether my action is negligent or not. As a doctor, I have made errors in my own hands. I have seen errors happening around me when I was teaching and my students were performing. I have seen consequences of error, which have been the sufferings of the people or the patients on whom these errors kind of got committed. And I used to see, on one hand, our doctor friends and colleagues coming up, telling their side of the story. Looking at their side of the story, you would feel that, well, maybe at that point of time, if I was there in that place, maybe I also might have done the same kind of stuff. When you look at the suffering from the side of the patients, you realize that the sufferings were really very bad. And sufferings are not only physical suffering, there are mental sufferings, psychological sufferings, economic sufferings, job loss sufferings. yeah, permanent disability kind of suffering. So sometimes sufferings can be very, very large. And nobody really pays for those kinds of sufferings, unfortunately. Yeah. That is why people will say that, well, whatever you did not do it the way it should have been done. Or you might have done it, but I don't care. Ultimately, end result was not what I desired, or what you told me, or what you promised me. And that is why people will call it as negligence, where the doctors will call it as error of judgment. Right. Now, legally, people will define that, well, error is something which is known, deficient negligence is where you have done something which is substandard. I would say that when you use the word negligence, there is a tone of somebody doing something inferior which is blameworthy. And when blameworthiness comes, people get annoyed. I mean, if at all suppose somebody has lined up causing a complication in the surgery, outcomes remain the same. But when you call it as an error or a complication, probably that blameworthiness goes down. So that is, according to me, the real difference between these two.
The acts remain the same, but the facts of the case which comes in front of the judge makes him feel that this particular act, which was the same, whether it was a case of negligence or a case of error of judgment, if the blameworthiness appears to be less, then the judge might give a benefit of doubt to the doctor. So it all depends on the facts of the case and how they are presented. So if an averagely skilled doctor in a given situation would have also done that kind of an error, then maybe the blameworthiness may be a little less. So that's how we
that is how they kind of draw the line. Correct. But I need to really point out that look at the mechanism or the system, okay, of healthcare delivery. That ultimately there is no benefit, okay, for a doctor, okay, to cause harm to the patient. I mean, we are not talking of financial issues or overcharging or cut practice. That is not what we are talking of. I am simply talking of something as simple as this, that let us say if I have to take sutures on the patient's skin, okay, why would I not want to take them so that the wound will heal properly? There is no reason. There is no financial incentive. There is no incentive of any nature. As a matter of fact, I know that if I do something which is not correct, then in fact I am going to get backlash. In fact, my reputation is at stake. But our legal system is of such sort that if the patient wants to get some compensation, patient has no alternative but to tell the judge that this doctor is negligent, this doctor is of inferior quality, this doctor is an idiot, etc., whatever you want to call it as, because our system is adversarial in nature. If today, if I go to the court and tell the judge, look, I am otherwise quite okay, I know that there is an error of judgment, the doctor did his level best, but this is what has happened. Okay, I have spent 20 lakhs to recover from this problem. Please pay 20 lakhs rupees to me. Please let the doctor pay 20 lakhs rupees to me. Judge will say, sorry, we will not accept that. So, blame freeness in the system is not there. Blaming system is there. Unless you blame, you don't get compensation.
Is it a possibility that our Indian judicial system matures to such an extent that one fine day our consumer forum will start giving compensations without slapping blame on the doctor, so that even the doctor comes out clean from that situation and the patient comes out happy because the patient got a compensation?
At this point of time, okay, currently there is no blame mechanism available in our system of working. There are few rays of hope which I will talk about it little later, and probably what could happen down the line. But at this point of time, there is nothing called no blame compensation, which is probably possible in our mechanism.
And the second point, you are very right in saying that doctor would never want to create complications, isn't it? But do you, as a doctor, and you are a legal person also, have you seen any situation wherein the doctor was so grossly negligent that he deserved to be arrested?
At this point of time, a aggrieved patient, okay, has which all places to go, which all forums to go. The commonest one which they go to is police. Okay, according to me, one of the most non-productive mechanisms to do, because primarily, and this is what I'm quoting from the Supreme Court, I'm not quoting from what I'm saying, that primarily we need to understand that the criminal mechanism of judiciary primarily works on the principle called mens rea. That means the intention, okay, is important. And it's a very common example that we teach our law students, that I am seeing somebody in front of me, there is a car coming, that man is trying to cross the road. I feel that the car will crash into that man will suffer. That is why I push the man so that he crosses the road quick and fast. Okay, but unfortunately, he kind of survives the possible potential car crash, but he dashes onto a pole, okay, has a head injury and dies. Okay, now this is a condition or a scenario where what is my intention? Intention was to save the life of the another person, not to kill him. But if at all there was no car, there was nothing, and there was a reason for me, okay, there was a reason for me to kind of push him. I was also carrying a weapon, okay, there were some previous circumstances that there was a reason for me to kind of have an interest in him dying, and I push him and he dashes onto the pole and dies, then that will be called as murder. So the action remains the same, but the intention is totally different. The previous case, intention was to save, and in this case, the intention was to actually kill. And it is the intention that decides criminality. The action does not decide the criminality. Now, it is obviously very simple that if suppose I want to kind of cause death of another person, okay, why would I take him on the operation table and give anesthesia and do some botched up surgery and kill him? There is no reason for me to do that, right? So it is obvious that there is obviously no criminal intention, okay, of a doctor to cause death of a person. So primarily, there is no mens rea at all of any nature, okay, to cause death of the person. At best, one may say that the doctor did not take requisite care, and hence it was the rashness or carelessness of an extreme degree that led to such kind of an occurrence. But for that, it has to be rashness of the ultimate order. What do you mean by rashness of an ultimate order? Something like this, that a nurse would know that an injection, if at all I give this much of injection, a human being will die, and I actually end up giving this much of injection. Okay, when the dose is supposed to be 0.1 milligram, not even 1 cc. I have injected 100 cc of that injection. Maybe that can be called as a criminal negligence. Or let's say somebody is kind of sexually molesting some patient or something of that sort. Maybe that will come up in a criminal category. But otherwise, 99.99999% of cases will not be able to fulfill the real scrutiny for it to be called as criminal negligence. And that's why the Supreme Court has stayed away from punishing a doctor for criminal negligence. Of course, you will see some cases where the lower courts have convicted the doctor, but the doctors have gone in appeal, and ultimately in the Supreme Court has taken a stand that yes, there probably could be negligence, but still cannot be called as criminal negligence. I mean, we have an example of a very famous actor who was drunk and he was driving. His car went onto the footpath and caused damage to people. And even in that case, they could not prove that he was criminally negligent. So here, though, it's a sophisticated doctor who is going and doing a surgery and something has gone wrong in the surgery because of which somebody has lost life. It is so very far, okay, to think of somebody getting criminally implicated in such scenario. But what happens is, because of lack of this understanding, the common people, politicians, probably sometimes lawyers, they chadafy the patients that you want the doctor to be behind bars, you want to take revenge on the doctor, go to the police station, file the case, you keep on paying for 20 years to the lawyer from your nose, and at the end of it, you get a verdict which is against you, and the doctor comes out scot-free. So I would say that even if you want to take the revenge or whatever may be your personal feelings that we understand and accept, but this is not really going to work. Unless you have a scenario that there is somebody who is a non-doctor and practicing as a doctor. Okay, yeah. He is practicing without a requisite license. There it is criminal negligence. And there is no doubt, because you have an intention to defraud somebody to show that you are a qualified doctor or somebody of that sort. So barring those conditions, if a qualified doctor having a registration which is in place and is practicing the specialty or whatever is supposed to be his science, and if at all things go wrong, then it is extremely difficult to prove criminal negligence. And I would kind of advise people to stay away from this criminal machinery because it does not really give any benefit to anybody. Medical counsel job is completely different. It is typically to ensure whether the doctor has done the job according to the code of medical ethics. It has got nothing to do with negligence or no negligence. So no compensation can be paid to anybody. Hence, going to civil or more particularly consumer court makes a lot of difference, because that is where you can get compensation. The compensation can come up relatively faster. And third, and the most important thing is that the quality of evidence that you need to adduce need not be of that highest standard which is required in criminal court. And we all have heard these kind of sentences through Hindi movies के सौ गुनेगार छूट जाएंगे तो भी चलेगा लेकिन एक बेगुनाह को सजा नहीं होनी चाहिए, and all that. So all that kind of a stuff, okay, is applicable to criminal cases, which means the judge should not have a slightest out of doubt without proclaiming the judgment of doctor being negligent criminally. Which means you really require an extremely high level of evidence and extremely high level of credible evidence so that it is proven without any doubt or beyond a slightest doubt. That is the requirement of criminal law. Whereas in the consumer court, it is supposed to be propensity or preponderance of evidence. That means, okay, this is 60% likely, this is 40% not likely. Okay, so 60% I feel that there is a possible civil negligence, and 40% probably no negligence. 60 overweighs 40, so I will give a judgment in favor of proclaiming the doctor to be deficient or negligence, and I can award the compensation. So quick relief, easier relief, cheap relief is available in consumer courts and is not available in the criminal court or the civil court, or even all those health right commissions and all those kind of things makes no sense according to me. The Consumer Protection Act is amended 2019. Okay, it has become much more stricter and much more in the interest of the consumers. It's a different ballgame whether it is in the interest of the service providers or no. That's a different story. We are not getting there. But from consumer points of view, at the consumer's point of view, it is much more an easier remedy to go for. And that's why all matters related to medical negligence should go only and only to the consumer forum and to no other forum. That is what is my belief. Yeah, now you asked me about the last question about blame-free compensation kind of stuff. So I can say that some very strict rays of hope are being seen in the latest consumer forum or the latest Consumer Protection Act, the Consumer Protection Act which came in 2019, where they have said that there is a scope for mediation, okay, in these kinds of scenarios. Unfortunately, the mediation has been restricted as far as healthcare is concerned. So if there is a grievous injury, they do not want to have a mediation. According to me, they should have kept mediation for that also. So that's a difference of opinion over there. Of course, it's a law which is passed by the law of the land and parliament. So me raising a difference of opinion is not necessarily going to make a difference. But when you talk of mediation, automatically the blameworthiness goes down. So here, what you are trying to do is that you are not trying to say. So it's like typical, fight on the road. I dash the car on somebody, okay, and rather than तुमने ऐसा किया, हमने ऐसा किया, तुमने ब्रेक डाला, तुम्हारा ध्यान नहीं था, and all that, you come to a conclusion. Okay, come on, let us sort it out. You have insurance, I have insurance. Let us claim insurance. Your गाड़ी is repaired without you having any kind of a trouble. So the whole modality changes. The modality changes from finding a solution rather than trying to prove to each other that who was more wrong and who was less wrong. Yeah, so that is typically what is called as mediation, and hence probably very strict ray of hope probably is being seen, but far and long way to go to reach that real blame-free kind of a compensation culture, which is available. There are many countries like New Zealand, certain parts of Australia, etc., where this kind of a blame-free culture is available, where compensation is given to people only to make good, okay, of the losses that they have suffered. and without blaming anybody. And I think that will be a very ideal compensation methodology, because of which the defensiveness amongst doctors will go down, and they will be more proactive in taking difficult cases, challenging cases, and ultimately giving treatment to people. This will also reduce the cost of medical care, because currently every doctor is concerned about the risk and the cost that is involved, and that is one another reason because of which the cost gets escalated as far as healthcare goes. And that's an example across all the world. I mean, you see US system is very costly. So are they using some different medicines or so? Answer is no. The exemplary compensations which have been paid in the US are the biggest reasons because of which the cost of healthcare has significantly gone up. So I fear that we may go in the same direction, and that's not in the best interest of healthcare as such on this globe.
Yeah, that's exactly the reason why this channel is there, to bring not only the doctors but all the clients together, so that together we find solutions. And one very good message you gave was there is no point in making a criminal case against the doctor. And there is a ray of hope when it comes to, if there is nothing that is coming up for medical negligence in the mediation cell, then there can be something called as an out of court settlement. And one of these days in, we'll make a complete video with you, Nikhil, on the concept of out of court settlement. Why is it that we need to go to the court to get the compensation? The doctor and the patient, where there was a damage, can come together, sit together, decide and settle the matter. But whenever there is a complication that occurs, you tend to blame the doctor always. Doctor ne mistake kiya hoga. But Nikhil, do you really feel, we work in hospitals, we work in a system, is it always that the doctor fails, or is it that the system fails? Because there is a possibility that the doctor is only one part. Like if a pilot is actually flying a flight, he is only one part. He is the pilot, but there are so many other things that are going on in preparing the flight. Only then he can fly it properly. So similarly, when a doctor is doing a surgery, there are so many things that have to happen in a proper format. Only then everything goes on smoothly. So do you think, Nikhil, instead of every time blaming the doctor for having caused the damage, there is a need for everybody to work on the patient safety?
So basically what happens is, today the healthcare has become very complex. Okay, it's not very simple kind of a thing that one single doctor comes with a bag and gives very few medicines to somebody, and so that the treatment is taken. There is a very interesting work that happened in Israel. Okay, some biomedical engineers were made to sit in a complex environment of ICU and only to observe what is happening in ICU. Now, we all know that in the intensive care unit, there are people who are very serious, who are tagged to machines, there are lots of tubes, they are probably on ventilatory support, so on and so forth. And when in such kind of a critical condition or a scenario, they found out that there are potentially 260 moves or 260 things, and even one of them going wrong can lead to a problem somewhere or other. To give you an example, there is somebody who is tagged onto a ventilator, and a ward boy wants to change the bed sheet, okay, or wants to change the position of the patient or clean the patient. Okay, potentially there is a possibility that something may go wrong, pressures may go wrong, tube may come ahead, go in, they get displaced, whatever it is. Okay, so there are potentially so many. Now, in that whole scenario, how much is the role of the doctor? Doctor is going to be coming and deciding the treatment or maybe monitoring the treatment, but there's so many other things which are happening. Okay, imagine a nurse, okay, who might have had some kind of a cough, cold kind of an infection maybe, okay, and unknowingly she coming onto the duty, okay, and passing on an infection to already immunocompromised patient, and hence that patient developing pneumonia. Is it possible? It is definitely quite a possibility. So there can be so many such kind of factors which are beyond the control of one single human being. Unfortunately, in healthcare, unlike in airline industry, the doctor becomes the face of the whole process. Whereas in airline industry, pilot doesn't become the face. Okay, pilot is faceless. Nobody kind of boards the flight looking at who is the pilot who is going to fly that aircraft, right? But that doesn't happen with the doctor, and that's why there is an overt tendency of blaming everything onto that particular doctor, when actually not that everything is entirely controlled by the doctor. And to some extent, I think the society, including doctors, need to take blame, because collectively we are not very open to accepting the risks which are involved in the treatment. And it has been my personal experience that so many times when I try to explain the patient that, look, I'm doing this surgery and there could be some complications, etc., etc., patient just kind of said, no, 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 we don't want to hear that. We have come with complete faith and trust with you. Yes, I understand that you have come with faith and trust, but at the same time, it is a fact that something which has happened across the world can happen in your case also. I mean, I am not above being a human being. So something which is known to happen across the world in a certain proportion is likely to happen, but people are not open to listening to them. People are not open. And I found a huge difference, okay, when I was in UK. So I sat with one person called Dr. Patrick O'Brien. He's one of the most reputed high risk obstetricians. He used to practice at that time in the UCLH hospitals, which is a probably the world's one of the topmost premier organizations. And he kind of delivers patients who are, extremely high risk. I mean, somebody who has had previous 4 heart attacks and now she's pregnant, and then he is trying to deliver and that kind of a stuff. But the difference I found was that in those kinds of scenarios, patients themselves, okay, were so very clear about what are the risks involved, etc., 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 in an objective manner, that decision making, and I mean, they were like parts of the team of the doctor. They were not coming as a guest to a hotel or something of that sort. They were like the team members, teammates, while deciding and taking decisions. And that is something which is lacking significantly. And it is the societal culture, because ultimately doctor also comes from the same society. So likewise, I have seen some doctors, when patients start asking questions, doctors get irritated. Okay, there, तुमको क्या समझ में आता है? I am the doctor. I understand everything. You don't ask me questions. Okay, so ultimately, I feel that it is the change in the society. Okay, it is the change in the understanding of the people, of doctors, patients, everybody. Okay, can make things more transparent and more friendly. Actually, holding a doctor entirely responsible for the problem is not correct. He is an important integral but a small part of the whole healthcare picture. Doctor's responsibility is limited. There are many other things which are there, and hence communication with the doctor, asking questions point blank, getting answers to the satisfaction. If you are not getting satisfactory answer, change the doctor, find out another doctor. That is my message to people across and all the viewers, because unless I genuinely feel that unless patients make a change, doctors and healthcare will not change.
Right.
So we need to educate people on this.
Yes, actually, thank you, Nikhil, because many new points have come up wherein our viewers will be interested in listening to, like I said about out of court settlement, then you talked about patient safety alliance, then no blame compensation. We can someday talk even about apology. I mean, whether
Absolutely.
if there was an error, if the doctor comes and apologizes to the patient, then doctor, this apology that the doctor has given, should that be used in the court of law as an acceptance of guilt and things like that? There are many topics which will come up, but I think we will take advantage of this YouTube video to discuss about such topics, and we'll invite people also on this YouTube channel, so that we'll have more and more people discuss one topic at a time, so that we'll be able to get better answers then. But today, before we sign off, Nikhil, I wanted to ask you one question, because in my previous video, I spoke about while in the court of law, if whenever the judge is judging a case of a medical negligence, the one thing that he first finds out is, does the doctor have the qualification that he claims to be having for doing that particular case? Like if he does a gynec case, does he have that qualification for that? So I wanted you to tell the viewers about what does the court expect the doctor in terms of qualification. Then let us know about cross-pathy practice. I mean, one pathy, a homeopathy doing an allopathy practice and vice versa, or a Ayurvedic person doing a allopathic practice and vice versa, and cross-specialty practice. I mean, somebody who is a cardiologist does something which is supposed to be done by somebody else. So what is the court view in general about these cross-specialty and cross-pathy? Before signing off, let
Yeah.
our viewers know about this.
Probably a very complex question to address, but first of all, let me make viewers understand as to what are the kind of systems that are available in our country. At this point of time, we have the enlisted mechanisms or enlisted pathies, that is allopathy, homeopathy, Ayurveda, Siddha, and Unani. Now, these are the only 5 pathies which are technically called as pathies which are accepted by law. So, electropathy, etc., naturopathy are not the pathies which are accepted by law as a medical degree or a medical education qualification. So first message, kindly do not go to these people, say naturopaths, etc., with an ideology that you are going to a doctor. You are not going to a doctor. That is first message that I want to give. Secondly, these pathies have watertight compartments. Why are they watertight? Because it depends on what has been taught to them. So, for example, in the allopathic science, if I am not being taught about Ayurvedic science, then it is expected that how will I come to know about how the Ayurvedic medicines work? And if I don't know that, who gives me authority to write Ayurvedic medicines? On that basis, it is considered that there should be a sense of watertightness, that nobody should be able to give another type of a pathy. But to counter that, okay, let me put it something of this sort. Now, it is a common practice, okay, that use of adrak, okay, is supposed to be beneficial for throat. Okay, now suppose somebody brings adrak ka goli. Are you going to say that, oh, as an allopath, you have not studied the properties of adrak in your medical college, so that's why you cannot write goli of adrak? I'm not too sure whether that's the right argument to kind of talk about, especially when it deals with OTC products, that means products which are available on the counter. So if there is a certain product which is available on the counter, where a person who has got zero qualification, if he can also take that product from the counter, why could you say that, oh, the allopathic doctor cannot write this or cannot write that, so on and so forth? And the same would apply, probably according to me, to a homeopath or even an Ayurvedic doctor. I am not in favor of these watertight systems, okay? I mean, I rather call them as caste system in healthcare. The day you are born as an Ayurvedic doctor, you are born in a certain caste. And then somebody who is an allopath says that, oh, you are from other caste, so we don't want to kind of deal with you in any manner. And typically that is what is the current mechanism. But ground level reality is that in order to deal with the shortage of allopathic doctors, there are certain states who have created some kind of bridge courses where an Ayurvedic doctor is taught in a limited manner about certain allopathic drugs, and he is officially sanctioned or allowed to use those medicines in the practice. Sum and substance of the story is, if there is a documentation of education and sanction of law that you can use certain medicines, then even if you are an Ayurvedic doctor, if you are writing allopathic medicines, up to a certain extent, that is allowed by the law. General, larger principle, something which you have not been trained in, is not to be practiced, and hence in the larger sphere of things, homeopath should not prescribe Ayurvedic medicine, or homeopath should not prescribe allopathic medicines. There is a case of Ashwin Mehta's case, very famous in the Supreme Court, where although that particular doctor who was a homeopath gave the right treatment, he was still considered to be negligent because he did not have the requisite qualification to give that particular treatment, although the treatment that was given was right. So that's why there is a verdict on this particular thing. So sum and substance of the story, cross-pathy practice is to be discouraged in general. However, need of the hour has to find out, certain ways to come over the problem rather than having nobody giving the treatment. Let there be somebody giving the treatment, and that's why these kind of you may, if you want to call it as, you may call it as backdoor entries, if at all. But these entries have been created, and that's why to some extent there's a sense of rationalization amongst these kinds of cross-pathy practice. So the larger principle is no for cross-pathy with these kinds of exceptions as far as the law of the land is concerned. So I hope that I have not confused more and still managed giving some kind of an answer. But if at all it is confusing, maybe I'll readdress it at some other point of time.
No, we will one of these days we will also make a video wherein we'll call people from Ayurveda, people from homeopathy, and we'll have a discussion, because eventually our country is talking about holistic approach. Whenever a patient comes, the patient deserves not only an allopathic treatment, but sometimes a holistic approach wherein some homeopathic drugs are given, some Ayurvedic drugs are given, and we take advantage of all the pathies that we have in our country. So if we are talking about a holistic approach, then the doctor should be allowed to use those medicines also. So that is the way our judiciary will also mature.
So to be very honest with you, at this juncture of time, there is no real judgment. I mean to say, there is no real law, okay, that has been passed by the parliament about the cross speciality kind of a practice. Okay. So there's no law, really speaking. A lot of these are judge-made laws, and these judge-made laws basically are based on the facts of that particular case. Okay, because for all you know, there could be somebody, okay, who is a MS general surgeon. Okay, now the fact that he's a general surgeon, and in age-old days, the fact was that there were only two types of specialties. One was surgery, one was medicine. There was nobody called neurologist and cardiologist and etc. So no super specialization was available. So in those days, general surgeons were the surgeons. I mean, they used to do orthopedic cases also and gynecological cases also. As and how the specialization has kind of expanded further, as one deepened further, these kind of cross-speciality boundaries have also come up. So there are good number of such kind of case-made laws which prohibit a general surgeon from doing, say, a gynecological surgery, okay, or a gynecologist to probably do, say, appendix or hernia or some such kind of a thing. So there are a lot of these case laws which are available. But I would say that at this point of time, there is no clear legal demarcation. However, again, the same message to the consumers or to the patients, that we are not interested in proving who is wrong and who is not wrong. We as consumers and patients are interested in our well-being. And hence, if we kind of get ourselves a little bit more literate about what are the qualifications. So now somebody who is a specialist, okay, will generally have a qualification of MD or MS or DNB. Somebody who is a general practitioner or who has got a graduate degree will have a degree of MBBS. Somebody who is a super specialized kind of a person will usually have a qualification like MCH or DM. So at least if at all people or the consumers are intelligent enough, okay, to cross-check, reconfirm the qualifications of the people, they themselves will be able to identify as to are they going to a right person or a person having a right qualification. Okay, so this is what is needed to be done.
And now the viewers will then agree why I call you the guru in the medical legal field. That is because the kind of knowledge you have and the kind of grasp that you have about the subject. So thank you very much for being here with us today. Thanks a lot.
Thank you. Thank you so much.
That's all the time we had with Nikhil today, but I'm very sure that with this world of information that Nikhil has opened for us, more questions will have taken shape in your minds. Do put down your questions, your requests, your doubts, even some anecdotes about your medical experience in the comment section below. And I'll get Nikhil back on this channel for another discussion. And before I sign off, do not forget to like this video, subscribe to this channel, and share it with anyone whom you think can benefit from this information.